What if I told you the first half minute after you open your eyes may be one of the most dangerous cardiovascular moments of your entire day? And what I'm about to reveal in mistake number one is so overlooked, so ordinary, and so deeply woven into morning routine that millions of older adults do it without the slightest suspicion that they may be piling extra strain onto a heart that is already under pressure. I'm Dr. William Lee, and if you're over 60, I need you to stay with me very carefully, because this is not about rare disease, strange genetics, or some exotic treatment. This is about what you do before breakfast, before coffee, before you've even fully cleared your throat. There's something cardiologists have known for a long time, and it should make every senior stop and think. Heart attacks, strokes, and sudden cardiac events do not happen randomly throughout the day. They cluster. And one well-known review reported that between 6 a.m. and noon, the risk of heart attack is about 40% higher than if these events were evenly spread across the day. That matters because most people assume morning is the safest part of the day. You're rested, you've just woken up, the day hasn't started yet, so what could possibly be wrong? But your body doesn't wake gently. Your hormones shift, your blood pressure rises, your heart rate climbs, your blood vessels change tone, and your circulation has to go from nighttime mode to daytime demand very fast. Please subscribe today for clear, heart-saving guidance that protects your family, sharpens your decisions, and helps you age with confidence. And here's what makes this truly dangerous. The natural morning cardiovascular surge is not automatically a problem. A healthy body is designed to handle it. But when you stack bad morning habits on top of that surge, you can turn normal physiology into a perfect setup for chest pain, dangerous blood pressure swings, fainting, rhythm problems, or a heart attack that catches you completely off guard. By the end of this video, you're going to know the 11 morning habits that quietly increase heart attack risk. And more importantly, you'll understand why mistake number one, the one that takes less than 30 seconds, can be the habit that magnifies all the others. Before I show you mistake number 11, let me tell you about Frank, because his morning routine looked harmless. Frank was 72, retired, disciplined, proud of the fact that he still woke up early every day. He told me, Doctor, I don't understand it. I'm doing everything right. I don't eat junk. I don't stay up late, and I don't miss appointments. But every morning he woke with a dull headache, a dry mouth, and a kind of heavy fatigue that never seemed to lift. By noon, he'd feel functional again, so he ignored it. He thought it was age. He thought it was poor sleep. He thought maybe he just needed stronger coffee. What he did not think was that his heart and blood vessels had been working against repeated oxygen drops all night long. Mistake number 11 is waking up with warning signs of sleep apnea and brushing them off as normal aging. Loud snoring, gasping, waking with morning headaches, daytime sleepiness, irritability, poor focus, dry mouth, and that I slept but still feel exhausted sensation are not little quirks, especially in older adults. Sleep apnea has been linked to higher rates of high blood pressure, stroke, coronary artery disease, and heart failure risk. It can also drive sudden overnight oxygen drops and morning blood pressure problems. Frank was not starting his day from a rested baseline. He was starting his day already stressed at the cardiovascular level before his feet even touched the floor. Once Frank was evaluated, the pattern made sense. He wasn't lazy, he wasn't weak, and he wasn't imagining anything. He had been spending years waking into mornings where his body was already compensating, already elevated, already strained. And that's the first lesson I need you to lock in, because the mistakes that follow all build on it. Morning danger doesn't always begin when you wake up. Sometimes it begins during the night and only reveals itself when the day starts. If you consistently wake with headaches, heavy fatigue, choking, or your family hears loud snoring and pauses in breathing, do not dismiss that. That morning issue may actually be a heart issue wearing a sleep mask. Now, let me show you mistake number 10, because this is one people make while trying to feel better, and it can tighten blood vessels before the day has even begun. Let me tell you about Helen, 69 years old, who woke every winter morning stuffed up and miserable. Her routine was simple: sit up, reach for the box on the nightstand, swallow a cold pill, and start the day. She did it without a second thought, because the medicine was over the counter. To her, that meant safe. But over several mornings, she noticed her heart pounding more, her blood pressure readings climbing, and a weird sense of internal pressure she couldn't explain. Mistake number 10 is taking decongestant-style cold medicine first thing in the morning without thinking about what it does to your cardiovascular system. Some common decongestants constrict blood vessels. That's how they dry out the nose and sinuses. But if you have high blood pressure, heart disease, prior stroke, heart failure, or even a heart that's already dealing with morning surge, that is the last thing you want, because you're adding extra vascular tightening on top of a period when your body is naturally shifting upward in pressure and demand. It doesn't matter that the medicine came from a pharmacy shelf. Over the counter does not mean over the heart safe. And here's where this gets more complicated. When people are sick, their cardiovascular system is often already stressed by inflammation, poor sleep, dehydration, or fever. So the pill isn't acting in isolation. It's acting on a body that may already be less stable than usual. Helen thought she needed stronger blood pressure medication. What she actually needed was to stop putting vasoconstricting cold medicine into the most reactive part of her day without guidance. If you wake congested and you have heart disease or uncontrolled blood pressure, do not assume your favorite cold remedy is harmless. Read the label. Ask your pharmacist or clinician. It can matter more than you think. But mistake number 9 is even more direct, because it does not sneak up in a pill. It arrives in smoke. Let me tell you about Robert, 71, who had one rule every morning, no matter the weather, no matter the season, no matter what his wife said. Before breakfast, before washing up, before talking to anybody, he stepped outside for his first cigarette. He called it his moment of peace, his way to clear his head before the house got noisy. What he did not realize was that this peaceful ritual was hitting his body with nicotine at the exact moment his cardiovascular system was already climbing into daytime gear. Mistake number 9 is smoking or vaping first thing in the morning. Nicotine makes your heart beat faster and your blood pressure rise. It also makes clots more likely to form and contributes to plaque buildup in arteries. So imagine what Robert was doing. His body wakes, hormones rise, blood pressure begins its normal upward move, and then he adds a chemical that accelerates heart rate and constricts the system even further, all before food, hydration, or proper settling. That is not a calm routine. That is a strain routine. And if your arteries are narrowed, your blood pressure is poorly controlled, or your heart muscle is vulnerable, that first cigarette is not a comfort. It's a challenge. Robert used to tell me, it's only one. But heart physiology doesn't care whether the habit feels emotionally small. It cares what the habit does in real time. One cigarette at the wrong moment can be more significant than people think, because the morning window is already biologically loaded. And this brings us to a pattern you're going to see again and again, all the way down to mistake number 1. It's not just the habit, it's the timing of the habit. A body under morning cardiovascular transition is more sensitive to bad inputs, which means the same behavior that feels tolerable at 2 p.m. may be far more dangerous at 6:30 a.m. Now let's go to mistake number 8, because millions of people believe this habit is helping their heart wake up. Let me tell you about Linda, 67, who never started the day without strong coffee. Not coffee after breakfast, not coffee after water, not coffee after sitting quietly for a few minutes. She drank it immediately, eyes barely open, hands still cool, stomach empty, body dry from the night, and within minutes, she'd feel a little shaky, a little faster, a little edgy. She blamed nerves. She blamed age. She blamed poor sleep, but what she was actually feeling was the collision between her natural morning surge and a stimulant that can cause a brief rise in blood pressure. Mistake number 8 is hitting your system with strong caffeine before your body has stabilized. Caffeine may cause a short-term increase in blood pressure, especially in people who don't use it regularly or who are more sensitive to it. And even when the rise is temporary, the timing matters. If you wake already dehydrated, stressed, behind on sleep, or you have untreated hypertension, a jittery morning coffee slam can amplify feelings of pounding, pressure, and internal urgency. I'm not saying coffee's evil. I'm saying context matters. Your body at 7 a.m. is not the same as your body at 2 p.m., and many seniors do not pay attention to that difference. Linda didn't need to quit coffee forever. She needed to stop using it like jumper cables on a half-settled cardiovascular system. A slower start changed everything. Water first. Sit up. Breathe. Move gradually. Then eat something if appropriate. Then have the coffee more thoughtfully. The symptom relief was almost immediate. And here's why this matters for what comes next. Because mistake number 7 hides underneath mistake number 8 in a way most people never notice. Many older adults think the coffee is the problem, when the coffee is only revealing a deeper issue that began overnight. That issue is dehydration. Let me tell you about Gloria, 74, who woke most mornings feeling slightly lightheaded, slightly weak, slightly off, but not bad enough to call anybody. She told herself it was nothing. Maybe she'd slept warm. Maybe she'd had a salty dinner. Maybe she was just getting older, and mornings felt different now. Then one day she stood up, took a few steps, and had to grab the dresser because the room shifted. She didn't faint, but she came close. That episode scared her. And the hidden problem was simple. Overnight, she was losing fluid, not replacing it early, and asking her circulation to perform with less reserve than it needed. Mistake number 7 is starting the morning dehydrated and doing nothing about it. Dehydration doesn't just make you thirsty. It can lower blood volume, contribute to dizziness, and in some situations cause your body to overcorrect by tightening blood vessels and raising blood pressure. Cleveland Clinic describes how dehydration can make pressure plummet and then potentially spike in response, which is exactly the kind of instability a senior heart does not enjoy in the first hours of the day. If you wake, stand, rush, caffeinate, stress, or take vasoactive medicines on top of dehydration, you are building a shaky tower and hoping it won't fall. And no, this does not mean everyone needs to guzzle water the second they open their eyes without thinking. People with heart failure, kidney disease, or fluid restrictions need individualized guidance. But for many older adults, the morning starts with a body that is simply drier than it should be, especially if they use diuretics, sleep in warm rooms, or don't drink much the evening before. Gloria felt better when she stopped acting like the morning began at full capacity. She began treating those first minutes as a transition instead of a race. And that idea, transition instead of race, is the key to the rest of this video. Because mistake number 6 is the habit that hijacks your nervous system before your body has even found balance. Let me tell you about Michael, 70, who kept his phone on the nightstand and touched it before he touched the floor. Emails, headlines, politics, family messages, medical portals, market numbers, weather alerts, all of it pouring into his brain before he had even taken 5 calm breaths. He told me he liked to get ahead of the day, but every time he did, he felt tense within minutes. His chest felt tight sometimes, not painful exactly, but clenched. His blood pressure readings were always highest when he measured right after scrolling. Mistake number 6 is starting the day with instant stress. The American Heart Association describes how stress can trigger adrenaline, speed up breathing and heart rate, and raise blood pressure. So when you wake and immediately flood your mind with conflict, noise, fear, urgency, or bad news, you are not simply catching up. You are activating fight or flight at the exact time your cardiovascular system is already moving upward naturally. And for some people, that combination is enough to create palpitations, pressure, shakiness, or a surge they mistake for just a weird morning. It is not dramatic to say that a phone can become a trigger device when used badly. Michael changed almost nothing else at first. He just delayed the phone. 10 quiet minutes. That was it. No headlines, no arguments, no checking who texted overnight, no doom scrolling, and his entire morning pattern softened. That should tell you something important. Many seniors are not waking into a heart problem first. They are waking into a nervous system problem that then becomes a heart stress problem. And if you stack that with caffeine, dehydration, nicotine, poor sleep, or rising too fast, the effect is multiplied. But mistake number 5 is one people make because they think being a little late won't matter. Sometimes it does. Let me tell you about Denise, 73, who kept her blood pressure pills by the kitchen sink, but took them whenever breakfast happened. Some mornings that meant 7:30, some mornings 9:15. Some mornings she got distracted and forgot until almost noon. She was not careless. She was busy. Grandchildren, appointments, chores, calls, life. But the pattern created more morning variability than she realized. Now, I want to be careful here because medication timing should be personalized with your own clinician. This is not a lecture that everyone must take every heart medicine at the same hour on the clock. It is a warning that casual inconsistency in a cardiovascular routine can have consequences. Mistake number 5 is delaying or skipping prescribed morning heart medications because the morning feels busy or because you, quote, feel okay. Medication non-adherence is linked to worse cardiovascular outcomes, and stress itself often makes people less likely to take medicines as prescribed. What matters here is not some rigid internet rule, but respecting that the morning window is already a time of physiologic change. If your clinician wants you taking a blood pressure medicine, rhythm medicine, or other cardiac medication on a defined schedule, the morning is not the time to freeload on wishful thinking. Feeling normal for 2 hours is not proof that your heart needed nothing. Denise improved not because she found a miracle supplement, but because she became consistent. That's it. Consistency sounds boring, and that is exactly why it saves people. The body loves predictability more than the human ego does, especially an aging cardiovascular system that doesn't recover from swings as gracefully as it once did. But mistake number 4 is more physical and much more immediate. It's one of those habits older adults call refreshing, even though it can destabilize them in seconds. And if you have ever felt a wave of dizziness in the bathroom and told yourself it was nothing, you need to hear this part carefully. Let me tell you about Samuel, 76, who woke cold every morning and loved a steaming shower. He would sit up, stand, head straight to the bathroom, and turn the water as hot as it would go. He said the heat made him feel alive. But one morning, halfway through shampooing, he had to brace himself against the wall because the room felt soft and distant, almost like he was suddenly standing in someone else's body. He never fully passed out, but he came frighteningly close. What he thought was just a dizzy spell was actually a warning that his circulation did not like what he was doing. Mistake number 4 is stepping into a very hot shower immediately after waking, especially if you are prone to blood pressure swings or orthostatic symptoms. Heat can worsen these issues. Cleveland Clinic specifically advises people vulnerable to orthostatic hypotension to avoid very hot baths or showers because heat can widen blood vessels and make it harder for the body to maintain stable pressure when you're already transitioning from lying down to standing. So think about Samuel's sequence. He woke dehydrated, stood up, walked, entered a hot environment, and asked his circulation to keep the brain perfectly supplied without pause. That is a lot to demand in a short span. And this is where seniors get fooled. Because if you don't actually fall, you assume nothing serious happened. But near fainting is not a meaningless event. It is feedback. Your body is telling you that the transition is too abrupt, too heated, too much, and you need to respect that. Slower rising, a moment seated first, hydration when appropriate, and avoiding extreme heat right away can make a major difference. But we're not done, because mistake number 3 combines temperature and effort. And for some people, it is the moment where morning becomes medically dangerous. This is the habit that shows up most in winter, but it can happen any time of year. Let me tell you about Arthur, 78, who took pride in never asking for help. One icy morning he woke, dressed quickly, and hurried outside to move trash cans and clear a path. He had not eaten, had not settled, had not taken time to warm up, and within minutes he felt pressure in the chest and heaviness in the arms. He stopped, rested, and the feeling eased. So he did what many older men do. He ignored it. He called it stiffness. He called it weather. He called it age. But cold weather can make blood vessels constrict, raise blood pressure, and force the heart to work harder, especially when exertion is layered on top. Mistake number 3 is rushing into cold air or sudden physical exertion right after waking. Cold itself can increase cardiovascular strain, and vigorous activity can acutely trigger cardiac events in vulnerable people. That's why snow shoveling, lifting, fast stair climbing, hauling, or hustling outdoors before the body has even fully stabilized is such a bad idea, particularly if you already have coronary disease, hypertension, diabetes, or you're simply older and less resilient to abrupt circulatory demand. Arthur did not need motivation. He needed pacing. The heart is not impressed by your toughness. It responds to workload, oxygen demand, vascular resistance, and reserve. Those are the rules. Now listen carefully, because this leads to mistake number 2, and mistake number 2 is the one that gets people hurt, not because the symptom was absent, but because the symptom was explained away. Let me tell you about Maria, 71, who woke with what she described as a strange discomfort. Not dramatic pain, not movie scene clutching of the chest, just pressure, slight nausea, a strange fatigue, and a little shortness of breath while getting dressed. And because it wasn't the classic picture she'd always imagined, she decided to wait. She thought maybe she slept wrong. Maybe it was indigestion. Maybe she was anxious. So she made tea and sat down, hoping it would pass. Mistake number 2 is dismissing morning warning signs because they seem too mild, too vague, or too strange to be a heart attack. The NHLBI and other major heart organizations are very clear. Symptoms can include chest or upper body pain, shortness of breath, dizziness, sweating, nausea, and in women especially, symptoms may be less typical. Some heart attacks start suddenly and intensely. Others begin slowly, with mild discomfort that people talk themselves out of taking seriously. That is why this mistake is so dangerous. It doesn't raise risk in the same way caffeine or nicotine does. It raises consequence. It turns a treatable emergency into a delayed emergency. Maria was fortunate. Her daughter insisted on urgent evaluation, and that insistence may have saved heart muscle. Because with heart attack, time is tissue. The longer the heart goes without oxygen, the more damage occurs. If you wake with chest pressure, pain into the arm, jaw, back discomfort, unusual shortness of breath, cold sweat, sudden nausea, or a feeling that something is profoundly wrong, do not sit and negotiate with it, and do not drive yourself if emergency symptoms are strong. Call emergency services. Acting fast matters more than acting brave. And now we've reached mistake number 1, the habit that seems almost too simple to deserve this much attention, but it does. Are you ready? Mistake number 1, the 30-second morning mistake that can magnify everything else, is exploding out of bed from flat to standing and launching straight into motion. Let me tell you about Eleanor, 75, because her routine is so common that many of you may recognize yourself in it immediately. Alarm goes off, eyes open, thought hits, I'm late. She swings her legs over, pushes herself upright, stands in one motion, turns, takes 3 steps, and that's when it happens. The rush in the head, the flutter in the chest, the brief dimming of vision. Maybe she grabs the dresser, maybe she doesn't. Maybe she steadies herself and keeps going, but the body has already sent a warning. Why is this so important? Because when you rise from lying down, gravity suddenly pulls blood toward the lower body. Your circulation must react fast. Blood vessels have to tighten, the heart has to adjust, and the nervous system has to coordinate the shift to keep blood pressure stable and keep blood flowing to the brain. As we age, this response becomes less efficient. Arteries stiffen, baroreceptors respond more slowly, dehydration, medications, heart disease, poor sleep, heat, and even a stressful wake-up can make the adjustment harder. That is why orthostatic hypotension becomes more common after 65, and why so many seniors describe these episodes as just one of those moments, when in reality, it is a cardiovascular stress event. Now, here's the part almost nobody explains. Even if you do not fully faint, even if you recover in a few seconds, those abrupt morning pressure shifts are not meaningless. They create instability. They can cause dizziness, weakness, palpitations, blurry vision, chest discomfort, falls, and sometimes reveal a body that is struggling more than you realize. And if you stack that sudden stand with dehydration, a hot shower, nicotine, coffee, bad sleep, skipped medication, or cold exertion, you create a compounded problem. This is why I saved it for last. The 30-second mistake is not always the only mistake. It is the mistake that activates all the others before your day has properly begun. Eleanor thought she was being efficient. What she was really doing was forcing a delicate transition to happen at full speed. When we slowed her morning routine down, everything changed. She sat first. She stayed seated. She took a few calm breaths. She moved her ankles. She let her circulation catch up. Then she stood. Then she paused again. No drama, no expensive gadget, no miracle cure. Just respecting physiology. And that respect is what most people lack in the morning. They treat waking like a switch. It's not a switch. It's a transfer, a handoff. And if the handoff is sloppy, the consequences can land on the heart, the blood pressure, the brain, or morning heart-safe protocol because in the floor. If you take one thing from this video, let it be this. Your morning is not empty time. It is loaded time, biologically loaded, cardiovascularly loaded. And when you honor that reality, you give your heart a better chance to do its job without being ambushed by your routine. Slow the first 30 seconds down. Remove the unnecessary strain. Respect the warning signs. And if what you learned today opened your eyes, share this with someone you love, especially a parent, spouse, sibling, or friend over 60 who thinks their morning habits are too small to matter. Sometimes the smallest habit is the one that changes the whole outcome. Take care of your heart, and I'll see you in the next video.